Welcome to Atlanta Global Aid. This is Atlanta Global Aid project with collaboration with IMEC. This project started last year, put it together, and we've been working with a lot of partners in Lewiston, Auburn area, and we make it possible today actually that this container is leaving on this week. And I want to thank people who contribute this project during the past year that worked hard to make it possible. And some of those people, it's a lot of people, I cannot name them, all of them. Some of those people, if I started naming, is Mayor Gilbert, Larry Gilbert, from Lewiston Mayor, stand right next to me. And he was actually he put a lot of support early on for this project and making sure possible that we got a lot of support from the city of Lewiston, which we had a press conference inside the city, and we did a lot of fundraising together, which Gilbert and also our Congressman Mike Michaud was actually that fundraising dinner with one of the speakers, keynote speakers. So I want to take this moment and thank people who contribute to these projects, such as St. Mary Regional Medical Center, and also Jim Lyson, actually, who's also here with us, was actually a big supporter of this project and actually put a lot of work on the ground and make a lot of trips out of state and locally to make this project happen. So I'm going to welcome actually a few people that actually also, I want to say thank you to Central Maine Medical Hospital that actually contribute some money of this project, and also Bates College, who have done a few contributions to this project, and a lot of people that I cannot name them here. So I'm going to pass on actually to Mayor Gilbert to say a few remarks about this project.
Well, certainly the city of Lewiston, Maine has a significant Somali immigrant population, and Atlantic Global Aid is to help people, refugees from Somalia who are located in Kenya, in refugee camps, and some are in hospitals there and so on. And of course we had the famine and the drought that took place there. And so people in the community contributed to Atlantic Global Aid to provide this medical equipment. And now the partnership has been formed between Atlantic Global Aid and the World, but also
Partners for World Health.
Partners for World Health, as well as IMEC, which stands for International Medical Equipment Coalition, here in North Andover, Massachusetts, where we are today. And so this partnership, working together, is able to now provide this medical equipment for a hospital in Kenya that will serve the people there who greatly need it. And so isn't it just wonderful that this coalition can be formed where people come together and people here are generous and give to assist our neighbors across the ocean. And so it's a wonderful project. The city of Lewiston was very supportive, as were the medical centers, both St. Mary's and Central Maine Medical Center, and Bates College in Lewiston, Maine as well, and a whole host of individuals, the Chamber of Commerce, for example, as well. So we are very thankful, and now the reality is the container will be leaving this week, and we'll be going there and cross the ocean and serve the people there. So we're very pleased.
Thank you. Jim.
Yes, my name is Jim Lyson. I'm on the board of directors of ADA. To our right, your left, is one of the suites that has been prepared. This is actually a patient room suite that IMEC puts together, these suites that then go into containers, and they contain everything necessary to operate a patient suite in the hospital that we're supporting in Kenya. We're also sending educational materials, computers, and other things that are needed. We hope this is just the beginning of a long-term relationship with IMEC and also our friends and relatives in Africa as well. The other piece is that we're informing our work here in the United States. As Mayor Gilbert said, nearly 10% of our population in Lewiston, Maine, and that's makes it over 4,000, probably 5,000 people in Lewiston are Somali. So we hope to learn things in our work overseas, extending that lifeline to Africa, and inform our work, especially with youth in and around the Lewiston-Auburn area, to make sure that they get their healthcare needs, in particular mental health needs, which are a great need within our community. So we're hoping to inform our work here in the United States and in the Lewiston-Auburn area with our work in Africa. So we think it's a good dual mission, and we're really proud that we were able to work a partnership with IMEC to get much needed medical supplies down in a big 40-foot container containing a number of these suites, which we'll be visiting shortly. Thank you.
I'd just like to add too that we have people here from Boston. Certainly the Islamic Center in Boston has contributed greatly towards this project as well. So certainly we're appreciative of the help that the people from the Boston Islamic Center, the Boston people in the medical community in Boston as well have contributed towards this project. And certainly, as you can see, there's one suite right here to a pallet. And so a container is filled with several of these, what they call a suite. So if, for example, if they need a piece of medical equipment for a room, not only does IMEC provide that piece of medical equipment, but also everything that goes in to support that piece of medical equipment in that room. So that's why they call them suites. And so, as you can see here, if you pan around, there's a whole huge warehouse full of these pallets that are prepared for certain projects. And for example, that's suite number 3, and this one here is going to Kenya. And it has everything for one room there. So a patient's room. So there's a patient room suite, and there's all kinds of other equipment. There's ultrasound, or there's dental suites, all kinds of that they prepare. And a project is developed in partnership with IMEC to develop what was needed, and then they put the project together. So we're very appreciative of this partnership that's been formed with IMEC.
Wanted to add another thing is that they communicate with the hospital in Kenya to understand their needs, but also their capability. They don't want to send equipment that can't be used because of a lack of technology or lack of training. So often that communication with in some cases, the doctors and administrators and educators there in Kenya is critically important to developing what is in the suite. So, and I think Annie was saying there'll be about 14 of those suites per container, 13 or 14, is that right? Or, yeah. So
yeah, upwards of 18 to 20 usually
Yeah.
fit in one container.
yeah, so lots of material, and you know we're proud of being able to make that happen, and we certainly appreciate the contributions of people that can assist us in that process. So thank you.
Go ahead, Ahmed.
Yeah, just I want to say thank you to Dr. Abdi. He tireless effort to do all the projects, not only this one, and he give us also hard time to finish the project. As a joke. Also, the mayor, Dean, all of you, I want to say thank you. Also, the staff of IMEC, you guys are wonderful because you take care of all the staff for the short notice. So I want to say also thank you.
Thank you.
And other than that, I want to just say this is the second project we're doing on behalf of AGA, Atlanta Global Aid. And we did the trip last year, me and Dr. Abdi and Mohammed, the president of AGA. I'm also board of trustee of the AGA. Just I want to say the community back in Masalani and Ijara district and northeastern Kenya, we tried to do our best to help you, and I wish you all the best. And we're coming soon, inshallah, hopefully, and make you happy. Thank you.
Yeah, Dini, actually, you want to say Dini? Let me introduce Dini, actually, who is Dini. Mohammed Dini is Executive Director and founder of Somali diaspora in Portland.
Portland, Maine.
Portland, Maine, yeah. And also he's been very supportive of this program for, we have a collaboration with Somali diaspora in Maine of Portland for Dini runs the organization. Dini also done a fundraising for us for this project during past year. He did a University of UMaine, was it? I believe? Yep.
Yes,
Yep, University of UMaine. He did a fundraising for this project, and it was big support. And he's here today actually to take part of actually this the end of the project, and and we really appreciate for his support. Thank you.
Oh, thank you for your introduction. I just only want to add two things. And when such a project comes, it's an opportunity for Somali Americans or those Africans who grew up this country to take opportunity to raise money and just think about it when the other immigrants who came here also supported back home, and Irish community actually gave us that example to us. And so we have to keep that legacy of not closing the doors when you get here, but also open doors for those you think are less fortunate, not having great medical and stuff. So we're very supportive of such projects, and we actually collaborated youth projects through African Diaspora Institute, through this organization. And we continue in our inspiration not only here, but that will do a groundwork job in Africa. So this opportunity, if we can save a single person, a single life, regardless of how much billions that I spend, that's actually worth of trying to save one life. And the medical stuff is one of the most needed, especially those areas, those neighborhoods, those hospitals, if someone from refugee or someone leaving that area. So thank you very much, and I'm glad to be part of it, and there's a lot to come that we will collaborate, and we learn collaboration actually through MAC, IMAC, and Global Health, Atlantic Health, and many other organizations. It's the only way we can get it, make it possible. And I always like to thank our mayor, which we did a youth project together, also here with us and taking part in this. So thank you.
Yeah, also I want to say a few remarks in Somali. So people who are watching now, I'm sure this will get out to everybody. Assalamu alaikum. My name is Dr. Abdulfatah Ahmed. magacay waa Dr. Abdulfatah Ahmed, waa Executive Director for London Global Aid. Waxaan dadka kusoo dhaweynayaa dadweynaha daawan doona insha Allah. This project will also socdaa Masalani in northeast Kenya. Last year waxaan sameynay assessment, waxaan sameynay mission aan ku aaday northeast Kenya ilaa xuduudka Kenya Soomaaliya la wadaagto, annagoo eegayna mataqaan waxyaalaan u qaban karo dadka baahan oo ku nool nawaaxiga waqooyi Kenya. Markaan eegnay oo group waxaan la soconay Atlanta Global Aid officialka iyo group Mareykan ah, waan tagnay meesha, waxaan soo sameynay assessment, waxaan soo ogaanay in baahida xagga caafimaadka iyo waxbarashada baahi xoog ka jirto. Marka missionkeenu waxa weeye inaan ka caawino, taas Atlanta Global missionka inuu fahamtay. Marka sidaa daraadeed waxaan ugu mahadcelinayaa dadka arrinta aad uga qayb qaatay iyo sida America kale, Jim Lyson, Mohammed Dini, Murshid iyo all IMAC. We did labadii sano hay'addan shaqeynaysay, waxaan dadaal badan baan sameynay oo ah inaan isku keeno dadka jecel inay dadka wax u qabtaan Afrika jooga. Marka waxaan rajeynayaa doonaa insha Allah projectan wuxuu ku socdaa magaalo dhaho Ijara District, Ijara District of Kenya, Masalani magaalo dhaho, waan tagnay, waa magaalo dadku dad aad u wanaagsan nagu soo dhaweeyay, dad baahi weyn baa ka jirta xagga caafimaadka. Sidaa daraadeed waxaan jeclaansanay dadkii aan u tagnay markaan last year waxay dhaheen waa inaad projectkan naga bilowdaan. Marka waxaan jecelnahay ilaa in haddana projectkan wuxuu ku socdaa Masalani Hospital. mataqaana insha Allah waxaan jecelnahay in meel walba Kenya barnaamijkan geyno, Soomaaliya, Ethiopia. Marka insha Allah Ahmed baan ku soo dhaweynaya.
بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله صلى الله